Hi, everyone, and welcome to our second installment of our third Thursday Community Town Hall series. As some background, the Alliance is a nonprofit organization that has served the greater Houston area for more than 35 years and has a long history of resettling refugees in the Houston area. We provide a number of comprehensive services to help refugees, immigrants, and the underserved residents secure the resources they need to attain self-sufficiency and improve their quality of life. We are incredibly proud to be resettling our Afghan allies that will now be calling Houston home. My name is Omar Concepcion, and I will be your moderator tonight for Third Thursday Town Hall focusing on refugee mental health and wellness. I am pleased to be joined by Dr. Sophia Banu, a psychiatrist at Baylor College of Medicine and Director of Psychiatry here at the Alliance, Arti Goswami, the Director of our Resiliency Programs, and Nadia Maynard, the Director of Refugee Mental Health and Wellness here at the Alliance. So thank you all for joining me tonight for our town hall. I'd like to start by asking you guys just some brief questions. So this March 2nd, we will be hosting our annual Refugee Mental Health and Wellness Conference. I wanted to ask you all first, how did the Mental Health Refugee Health and Wellness Conference get started?
All right, so I'm going to take that question. Thank you, Omar, for hosting this live stream. So it all started in 2017, late 2017, when USCRI approached Alliance to do something about refugee wellness. And so Dan, our CEO, decided that maybe having a mental health conference would be great. So in 2018 was our first conference, and we held it at St. Thomas University. That time we had about 171 registrants, 98 showed up, and there were things going on that day. It was Mrs. Bush's funeral, and there were other things going on. So we said maybe it was because of that there was lower attendance. 2019, we had 160 people register and attend the conference. 2020, we had 250. And 2021, last year, in the midst of the pandemic, we had 400 register, and it was a virtual conference 2020, out of which 319 attended. And we had people from Mexico, South Africa, Kenya, Bangladesh, and the states within the US, Colorado, California, Massachusetts, Pennsylvania, Maryland, New York. I think it's almost all the states out there, Georgia, Florida, Oklahoma, Michigan. And so we're hoping this year on March 3rd, we'll have definitely more than 400 register and definitely more than 300 attend. So we're really, really excited to be doing this again this year, virtually.
Thank you so much, Dr. Banu. So the next question I have for you all is, what is the importance of speaking about mental health when serving refugee populations?
So I can take that question. And again, thank you very much, Omar, for hosting this live feed. So while the Alliance has been around for over 35 years, the Alliance Wellness Clinic is relatively young and was established in early 2017, as Dr. Banu said, in response to an observed and unmet need for mental and behavioral health services among refugee, immigrant, and other underserved populations. And what we were seeing time and again from our case managers was that without the necessary supportive behavioral health care, refugees and immigrants were unable to meet their goals for self-sufficiency and improved quality of life because they had unresolved trauma. Many of these individuals and families had spent many years in transit before arriving in the United States. Many families had spent years in refugee camps and experienced extremely high levels of trauma and other adjustment disorders that really needed to be simultaneously addressed before we could help them become self-sufficient. The Alliance, because we have a long history of working with refugee and immigrant communities, there's a high degree of trust within the community. And that allowed us to engage with the refugee community and not just have conversations around mental and behavioral health, which, as you know, have a very high level of, or a high degree of stigma attached to them, but change these conversations. Speak about men's mental health, speak to women heads of household, speak about childhood trauma and other such matters and really get to the crux of it. So, we truly believe that these are very important issues to address and very important conversations to be had. That really was the purpose behind the Wellness Clinic.
Thank you so much for sharing this, sharing a lot about the stigma, Artie. That is a big thing that the community, that we have to work on as a community. For Nadia in particular, can you go ahead? Sorry.
No, I was just going to say, Artie and I have the advantage of working together just because refugee health and social services are so critical that we are able to identify those mental health needs when people are seeking services for health, or whether they're trying to gain access to social services, which can have their own obstacles and raise another set of anxieties. We are able to then refer to our health and our mental health and clinic, as well as our wellness center. So I think that's really important that we see the person as whole. And I think that's what the approach that I love the most about the Alliance is, that we do take a whole community approach, and it's founded by the community, identified by the community as a need, and addressed as a whole. And so it's just something I wanted to add.
So I want to add something to that too, to everything that Arti and Nadia said. One of the reasons why this clinic has been really doing well is because it's located in Alliance, in the building. I'm talking about pre-COVID, and hopefully it's going to happen now post-COVID too. Well, we would have clients who would come to see their case managers, right, in their offices, or getting food stamp papers, or any other issues that they may have, and asking the case managers for help, and they could just come into our clinic at the same time. So they don't have to go to the hospital or to a clinic looking for one, or getting on a bus, or not having transportation, or the case manager being too busy to take them to a clinic where they would have to wait for hours on end. So I think having a clinic within the resettlement agency in the building is like a huge deal. That's my experience, because I had started the clinic for international trauma survivors at Ben Taub under Baylor, but I would be sitting in my clinic and nobody would show up because they didn't know how to get to my clinic. They didn't have access to transportation. Case managers were too busy, and I would have maybe one or two clients, at the most. And I knew there was a demand, there was a need for it. So when Dan asked me to join Alliance to do half a day or one day, depending on the grants, I was like overcome with joy, because that's exactly what I wanted, to be there to provide services to people who can access it easily too.
Great. And thank you, Dr. Banu and Nadia, for bringing those points up, because it is really important when we talk about refugee mental health to also make it accessible to the communities in which that need the service. So talking specifically about refugee mental health, can we talk a little bit about the intersection between mental health and social justice and what that looks like for our communities?
So justice, and transformative justice specifically, is something that is the centerpiece, I guess, of the refugee experience, because transformative justice looks at violence, abuse, and harm against a person, a community, but looks at it from a larger social construct, like the larger fabric of the community, and what we can do to correct and also gain access for everyone. And so I think it's fundamental to what we're talking about, because when you don't have access, you don't have justice, because then healing is not equitable. Healing is only available to those who have. And what we're really talking about is creating access points for everyone.
Thank you. And launching off of that access point, Dr. Banu and Artie, can you guys tell us a little bit about your experiences developing the Wellness Clinic and how you guys got started?
So Dr. Banu was actually one of the founding members of the Alliance Wellness Clinic, and she started it as a very modest community-based program, which literally looked like her and a resident and a manager going out into apartment complexes, using the community room, knocking on doors, bringing people out to basically say, hey, let's talk. right? So a very community-based approach. And I can talk a little bit about what the wellness clinic looks like today, but then I'll definitely hand it over to Dr. Banu, because I think it's important for people to also understand what the wellness clinic looked like when it first started. So today, psychiatry program. It's led by Dr. Banu, and it's in partnership with Baylor College of Medicine. In addition, we also have a counseling program, which includes individual counseling, couples counseling, family counseling. And then we also have a child psychology program, which includes counseling, psychological testing, and assessments. And all of our services pre-pandemic were provided not just in the clinic, but actually the vast majority of our services were provided out in the community, be it in apartment complexes or in HISD schools. The key was to really meet our clients where they were, both literally and figuratively. Post-COVID, things had to change. So we now offer our services through a hybrid service delivery model. So services are either in person or virtual through telehealth, depending on what is mutually acceptable to the clinician and the client. And then for a certain subset of our clients who qualify, we're actually able to provide all of our services free of cost. All of our services are provided by clinicians who are culturally competent, who have the appropriate linguistic capacity. When that is not available, we depend on our internal Alliance staff for translation and interpretation. I believe just within our Alliance staff, we speak over 30 different languages, if not more. But we also depend on translators and interpreters, to be able to, again, Nadia talked about access. I think, this is a very important part of, of access, of providing that culturally and linguistically competent care. So that's what the wellness clinic looks like today. It didn't always look like this. I think early 2017, Dr. Banu, it looked very different.
Very, 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 very different. I was mentioning earlier that we would, get in a van, Alliance van, with Aisha Koroma, who used to work with us. She was the manager, and then my resident and an interpreter, and she would drive us in this van, and we'd go to Southwest apartment complexes, and every week we would visit a different apartment complex. So one day would be the Congolese, Bel Air Garden Apartments, where we would have most of our Congolese refugees. So we would go and knock on the doors and say, hey, come on, let's talk. And then they would come up, and then they would give us a community room, and we would sit there. At times, we even had volunteers who would take care of the kids in another room, because most of the mothers, they had kids and they had to take care of them. So, and then the mothers would be with us, and we'd have, either we would just do group therapy sessions, or we'd have speakers sometimes. And so it depends, we would go to maybe Lazy Hollow apartment complex and then have the Arabic speaking women come and join us. And so this was really, an eye-opening experience for my resident in training. And I think it's really, really important that we create awareness and provide education to our young and upcoming students, because they were surprised when they saw the apartment complex. They were surprised when, some of them, would tell us, come inside, the way they were living, and the amenities that they had or that they didn't have. And so it was like, not only were we connecting with them in the apartment complexes, for the residents to be aware of how they live, or what they have or what they don't have, was really, really an important piece of this group sessions that we were doing. And also there was a lot of joy, and Nadia mentioned this earlier, it was just so much happiness. Like, they were so happy to see us, and sometimes there would be people waiting for us to come if we were a few minutes late getting to the apartment complexes. So this was really a good way to, make them feel safe, make them feel like they're being listened to, because they would come and talk to us about everything. Like, oh, I have this headache and it's not going away. Oh, I have this backache. And we would do like exercises. And at one point I remember, we went for a follow-up visit. And then one of them said, oh, I did this and it was really helpful. And we were like, show us what you did. And then she got up and then she started doing the exercise, and everybody started clapping, and we were like beaming, smiling. So it was really, really a great experience for us and for them too. But of course now it's definitely progressed more than just groups. We do other services we provide too. But that was the beginning, and I think it was a great beginning.
And now we're turning to the Afghan family program, which is going to be great as well. Hearing Dr. Banu talk about these joyful moments and just understanding how community can generate healing, how it has that generative quality is so important to what we do. And we know that we have many new arrivals who are looking for that community, that sense of community, and that place, that space to heal. And so I think that having this Afghan family program is going to be is really going to be fundamental to our to helping the healing process. So thank you so much, Dr. Banu, for sharing those memories.
Yeah. Thank you guys so much for sharing those experiences. Are there any other common experiences that you guys see among refugee populations that may be uncommon for other immigrant populations in particular?
Compared to other population, you mean?
Yes.
So one of the things that I try to teach my residents and my medical students and other students is about cultural humility. Mm. And you can, and I always tell them, you can be culturally competent. You can read a textbook, you can watch videos, you can educate yourself on other cultures. But cultural humility comes from the person who's sitting in front of you, because that person could be from Congo, but a village from Congo, one village from Congo to another village will be completely different. Their experiences, their culture, the way they look at things, and the way they handle things. So I think that is one really, really important thing. We can't just say, oh, he's from Burma, or he's from Iraq, or he's from Iran, or from Congo, or from Afghanistan, and lump them all together. So I think that's one really, really important thing that I try to teach. Whoever is sitting in front of you, he or she is the best teacher of their culture. So that's one thing that sort of stands out for me when I'm working with refugees.
I agree. And, to add to that, I think a little cultural humility can go a very long way in someone disclosing, sharing, opening up, and frankly, just coming back for a follow-up counseling visit, right? So thank you for bringing that up. I think that's very important. And I frankly think that's something that we do extremely well at the Alliance is, sort of take the onus on ensuring that we are well educated about the clients that we serve, right? You can serve someone from a country, but unless you know that country is a multi-ethnic country and you could be dealing with two individuals from the same country who come from different ethnic groups, you're not culturally competent, right? Or are you really? So sort of going through some of those, I think those nuances is what we do really well at the Alliance. What we often say is working at the Alliance is like working at the United Nations, but that really is true.
One thing I wanted to add, I'm sorry, I'm going to put on my psychiatrist hat, is regarding medications, if there are any psychiatrists or any providers listening, is that I always start at a dose lower than the lowest dose, because we have lots of refugees who are medication naive. They've never taken any medication in their lives, and if they're severely depressed, or if they become psychotic because of depression, or if they have panic attacks, and you want to treat them, you have to start with the lowest of the lowest dose, and you have to go really slow. So that's one thing, if there are any psychiatrists listening, so that's one thing to keep in mind, even lower than a child's dose.
Thank you for that practical advice, Dr. Banu. And once again, I encourage the audience who's watching on Facebook, if you'd like to, feel free to be engaged in the chat, ask any of our experts any questions that you may have about or refugee mental health and wellness. To pivot back to the Refugee Mental Health and Wellness Conference, are there any particular panels or things that we're doing at the conference that you would like to highlight specifically for our Facebook community?
Well, this year we've added a justice track, and I'm very excited about that. And so part of our justice track is going to cover disability justice. And I think that's a really great framework for understanding currently what our new arrivals, and as well as just, you know, seeing people as whole, and seeing their healing as you know, fundamental to their human rights, and to access to care. And so I just really want to highlight our disability justice panel, because too, we know that during war that people are coming with a variety of injuries as well. And also too, that, you know, there are a lot of invisible injuries. And so when we're talking about, you know, mental health and wellness, we need to consider all of those elements and create more accessibility and commitments to meet to our clients, to, you know, provide not only access, but a just and equitable space for them. And so definitely excited about the disability justice panel.
There are two things. I mean, there are all of the panels that we have, all of the tracks that we have are really fantastic. But since Omar, you asked about a few that sort of stands out for me. There's one with Chloe Crane from Interfaith Ministries, and she's been running groups with Arabic-speaking women, and now recently, in the past few years, with Afghani women. She's been running these groups since 2016, so for a long time, and she does a fantastic job. She is going to talk about her experience and how groups have helped the clients who attend. And in addition to her experience and sharing the lessons learned, we also having a few Afghani women who've been here. Some have been here for many years, some have been here recently, to talk about their experience. It's nothing like hearing from the horse's mouth, you know, like about what they're going through and what they feel would be helpful. We could sit here and say, oh, we should do this, but if it's coming from them, then, you know, people might listen and people might take that, and you know, if they're doing this kind of work, then they'll maybe hopefully attune their services the way that they express their needs. The other thing that I'm really, really excited about is AEDP, which is Accelerated Experiential Dynamic Psychotherapy. It's a mouthful, but this is a kind of psychotherapy which is based on neuroscience, attachment theory, it's body-focused approaches and transformation studies, and it's non-psychopathology based. That's what I like, and it focuses on a person's individual innate sense of healing, to grow and heal. So Dina from Cyprus, Dr. Dina from Cyprus and Dr. Dorel from South Africa have been working with the refugees using this model. And so what is interesting about this is, like, they reframe the notion of refugees as victims and helpless and powerful individuals, and the opposite, you know, that they have the strength to heal and it's within them, it's innate. And so for the therapist to sort of tap onto that, and it's all based on attachment also, and then there's a lot of neuroscience aspect to this. What they're going to do for 2.5 hours is going to have a conversation. They're going to introduce AEDP, but then they're going to have a conversation with us about their experience, and they're going to do not a training, but, you know, there's certain things that they do about creating portals with the client, and almost like doing a dance, or about how a mother and a child attunes to each other's needs, as opposed to mother just doing it, you know, cleaning diaper, feeding, but attending to the needs of the child. So it's like the attachment theory. I hope I'm explaining it okay, but, you know, it's the dance that you do with your client as a therapist. And also one important thing that they told me was that, you know, the psychodynamic kind of therapy that's done, you know, you don't show your emotions, you're supposed to be this blank slate, and that's not the kind of therapy they do. They want you to show emotions. They want you to show your emotions to the client also. So I think that's really, really important when we work with refugees. And the other thing that they'll be doing with AEDP is they'll be exploring Islam in the context of working with Afghani refugees, and how AEDP not just explores and respects the religion, but also enters into the spiritual experience of them. So I think if you're working with Afghani refugees, and this might be really a helpful tool to have. So I'm really excited, and I hope people who are listening will be able to attend to this.
Yeah, definitely. Thank you so much, Dr. Banu and Nadia, for sharing your recommendations. Here's a question from the chat to pivot a little bit. If you're not a social worker or a healthcare provider, are there certain actions that you can take to support mental health in refugee populations? So this is a question from the chat. Anyone can take it.
Well, we spoke a lot about, cultural humility, but also too some really basic, even just starting off, and you start with humble curiosity and create space for people to share their experience if they want to, at whatever comfort and level that they feel that they would like. And again, just centering them, their humanity, and helping someone feel seen and heard can sometimes be like incredible. It is often incredible. It's often just what people need, is just to feel seen and heard and held. And so those are pretty basic things that you do just by listening and becoming curious and not seeking to solve either. So I think oftentimes we all want to jump into our Texas tool belt and fix things for people. And sometimes that's just not possible. And it's okay, and sitting with that is okay. And so just having that humility to experiment with that, what that feels like. Yes, of course, there's opportunities to volunteer, and there's opportunities to be there for our communities. But also showing up with our values intact and centering their humanity is going to be probably the core, most fundamental thing that you can do.
Thank you so much for sharing, Nadia. So another question from the chat, this is for anyone in particular. Are there any books that you guys have read that have influenced the way you think about refugee mental health?
The Body Keeps the Score is one for me. Trauma Stewardship is another really good one. Healing-Centered Engagement Practices by Dr. Sean Ginwright also is really fundamental. Also just understanding and knowing transformative justice and disability justice principles, which you can get through Sins Invalid. My dogs want to speak up about this. Sinsinvalid.com or .org, and that's has all the disability justice principles.
Okay.
Can I put in a shameless plug?
Sure, go ahead.
So there are two books. One book is from the Bellevue NYU Program for Survivors of Torture. They wrote a book. It's called Like a Refugee Camp on First Avenue. Because it was on First Avenue, and it looked like a refugee camp. So that's one book. And the other book that I am one of the co-authors of, and that's why I'm putting a shameless plug, is the Trauma, Recovery, and Resilience. Is a book that we collaborated with many people from all over the world who work with refugees and survivors of torture, the highest to medical students to just social work students. So that's a book if you are interested in learning more about refugees, but not just about refugees, but about microaggression, about how to organize a health fair for refugees, stories of different refugees, different kinds of therapies used. So that's something that you should look up.
Thank you guys so much for sharing those recommendations. And as the last question for the evening, what are some resources for somebody who's just learning about this topic and is interested to learn more? Any resources that we could share with the audience in general?
I mean, basic resources, I would guess, is also too about being in the community and being a part of the community and so just volunteering. My internship got me into this work. My social work internship a long time ago, and it fundamentally changed my life. And so sometimes we gravitate to books and resources, but really the true life experience can teach us so much, and just getting closer to communities that you might not have access to. So yes.
Thank you.
So, since Nadia talked about her internship, I'm going to share with you why I started working with refugees. So I just completed medical school and I didn't know what I wanted to do. But I went to Nepal for a vacation, and I met one of my friends who was a social worker in Nepal, and she said, why don't you join us? You know, we have lots of women who've been tortured and raped, but they won't go see a male physician because of cultural taboos and, you know, problems with that. So, then I decided the next day I went to meet her boss, and I was offered a job. And that's how my path with refugees started. I mean, I had no idea that I'm going to be here today, but, you know, look for opportunities that are out there. If there's a passion for anything that you have, just go for it, and don't let anything get in the way. You know, the smallest of the smallest things can lead you to the biggest of the biggest. So don't, you know, stop yourself. If there's a passion, go for it.
Thank you guys, definitely. It's always great to follow your passion. We have one more question from the audience. I am a teacher who would like to provide lots of resources and other community space for refugee children and families. Is there a step-by-step way that you could provide doing this that is not overbearing?
Can you repeat that? What is she? She's a teacher who wants to provide resources?
She's a teacher who would like to provide resources to refugee families, and she's just looking for guidance on ways to provide resources that doesn't seem overbearing.
Can I suggest something?
Sure, go ahead.
So in my, and Aarti knows this, and Nadia, I don't know if you've seen my office, Omar. So I have a room at Alliance where I had lots of people donate lightly used clothes, utensils, shoes, toys, car seats. So it was all like in a big pile, you know. So I had some medical students who wanted to volunteer with me, and I said, can you just fix these things? And this amazing medical student who was working with me, doing the elective with me, she got a group of her friends, and you won't believe, she made a store inside my office. She had put all the clothes on hangers, ladies' formal clothes, ladies' casual clothes, men's shirt, jeans in different sizes, pants in different sizes, t-shirts in different sizes, children's clothes in different sizes, and it looks like a store. And so when I have clients, when I used to have clients in person, I would, you know, we would have a session, and then they would say, you can just go to their room and take what you want. And it's all neatly arranged, you know, and hangers, and they can try it on. And the joy and the empowerment that you're giving them is just priceless. I'm telling you, the look on their faces, you know, you're not asking them to look through this heap of clothes that's on the floor and take what you want. You know, it's the same thing, but just, I don't know, I mean, I'm running out of words and I'm getting emotional too, but you know, like, it's a store. They're coming to a store and getting a hanger and looking at the clothes and then trying them on and taking them. I think that goes a long way. I don't think my medications do anything, but that part where you're giving them, what do you call, empowerment, where you're giving them their dignity. That's what I was looking for, their dignity, you know? And that is not overbearing, I think. That is not overwhelming, I think, if you wanted to do something like that, you know? Like, and that's a small thing, right? Like, having half a day to arrange all these clothes, getting hangers and putting them and making them look neat. I think that's something that people could do.
Yeah.
And it goes a long way, really. I'm telling you, I still have people coming and say, can I come and take some clothes from your store? I'm like, yeah, sure, anytime.
I think it speaks to, Dr. Banu, I love that example, but it's like, it speaks to intentionality, care, and belonging. When you can do something with intention. And so teacher who submitted this wonderful question, having your students engage in something with intention, knowing the history of it, creating community around it, doing it with care, and then creating a sense of belonging. And that's what genuinely will go the farthest. And it can be something so simple like organizing the closet, or, creating a drive around diapers. We're always in need of diapers, by the way. So all those things can just be so helpful, and also teach at the same time something about creating belonging within our community for new arrivals.
Thank you, each of you, for sharing, and I want to thank each of you for your time. Sorry, Dr. Bono, did you want to add something?
Yeah, just very quickly, since I know I heard that she's a teacher the first time was, so you can start a Students for Refugees group in your school. My older son, he's in high school, and he started his own Students for Refugees group for the past 3 years. And every year, the number of students who are involved is growing because people want to know more about refugees and how they can help. And that's how this started too. So if you are a teacher, you could be the mentor, identify a student who might be interested in starting a Students for Refugees group. If you need more information, please contact Umar and I can provide you the information of the school that currently has a Students for Refugees group, a club.
Yes, definitely. The need for community is great among our refugee populations, and the need for them to feel connected to their new home and their new community is definitely something that we want to encourage among all of our viewers. But thank you so much for each of your time today. We really appreciate each of you spending the last 30 minutes with us talking about refugee mental health and wellness. I'd like to remind the audience that's watching from home that our Refugee Mental Health and Wellness Conference is taking place on March 2nd. So that's Thursday, March 2nd. We have a bunch of exciting speakers, and you can learn more about all of the issues that we have talked about today by joining our conference. Tickets are $20 for general admission and $10 for students who are looking for some CEU credits. Additionally, we will also be promoting all of our volunteer and refugee services programs on our social media. So if you'd like to visit us there, we will have more information for you, and we can guide you to the opportunities that you guys would like to have in our community. So once again, thank you guys for joining us tonight, and I hope you have a wonderful rest of your evening.
It's March 3rd.
March 3rd. Oh. We're out. Oh.